I'm Gina Agron. I'm with the Alaska Occupational Safety and Health Consultation and Training section. Has anyone heard of us before? What do you know about us?
I saw a webinar thing.
Oh, okay. Thank you. Thanks for attending a second time. Hopefully I'll give you more information. What do you know about us, sir?
How much?
Okay, okay. Well, I'm glad you're here. And thank you for everyone who doesn't know about us. Hopefully we'll share a little bit about what we do. But my partner here, Margaret Greutert, is, did I say it right?
Greutert.
Greutert, okay. At Kodiak History Museum. Oh, a little bit about yourself, please.
I'm from the Kodiak History Museum and met Gina in 2022. I'll talk more about that later, but we're a small museum in Kodiak across the street from the Alutiiq Museum.
Can you guys speak up just a little bit? So
Yes.
we can
And tell us if we get too loud. Okay. We have panel members. I want to thank Amanda Lancaster, who actually opened the world of museums for me a couple of years ago. She is here from the Alutiiq, and also the Kodiak Historical Society, one of the board of directors. Yes. And Stephanie Black, who is with the Anchorage Museum. And I met her actually through the American Industrial Hygiene Association. Brandy Howard is here. She's from Terracon. They're a private organization that provides safety, environmental safety and health support. And we'll tell you more about their bios as we get into the presentation. And then also AKOSH Schrager, and she has both environmental safety and health and museum curations expertise. So super excited to have them here. So I'm going to get on with the presentation because Margaret is timing me. So
You're gonna get my alarm go off.
Margaret, I am not able to move. There we go. I'm going to have to move like this.
Oh, you should be able to use your arrows.
That's what I thought.
Yeah,
Oh,
you got it.
there we go. This is to say that anything I say cannot be held against the U.S. government or the state of Alaska, that it represents me and only me. But ask me and we'll double check anything that, I've said. It's just that, have to do that. So why are we here? Well, a lot of times I'll come and talk about the things that we do. But I think what's important in Alaska, and I think Margaret agreed, is it's the partnerships that we build. And I was just talking with Bethany earlier, how did I run into this museums world? Well, Amanda had me in, but both of them said I could say this.
Yeah.
And then Margaret had me in. And so they request an AKOSH visit. We have to have 3 visits to get to your facility. And so we go in, and I'm kind of a jack of all trades. I go to construction sites, I go to manufacturing organization sites, and then I fall into museums. Well, Margaret was given the task of correcting the hazards that we identified. And one of them was a safety hazard. Now, I'm a health consultant. We also have safety consultants. One of those hazards was a safety issue that the local government was giving her a little bit of a hard time on correcting, right? And so Margaret connected me with Grant Crosby, who then explained to me what the issues were with your organizations, your facilities. And then we did a deep dive into the international existing building codes and came up with, I think, a solution that helped, maybe.
Yeah. We're in a historic building, so one of our hazards had to do with like the building itself and how we were using it, but we couldn't like correct it. We couldn't just build a new railing and demo it. So, yeah.
And so through that solution development, we then we developed an OSHA success story. So that gets published on the OSHA webpage. So this is a little bit about that. But here's the thing. It was written by me and Margaret and Amanda. And when it was finally published, everybody knows how editing goes, right? So it goes from us up to my boss, to their boss, and then it gets all the way up to federal OSHA, and they have some brilliant writers on their staff, right, who take away everything that we wrote about our partnership. And I was just so disheartened. It really hurt. So So I can't say that officially on my slide, but that's why I've got that ... So then we talked because that as I was calling to apologize to them, because the OSHA success story looked like, you know, I was underdog coming in and saving the day, and that was really uncomfortable because I knew nothing about museums when I first walked in. And so we then said, well, what can we do next? And the next thing was, well, some sampling. So who are we? When I say AKOSH C&T, I want you to know that we are very definitely not these guys. And any information that we receive as part of our visits does not go to those guys, the enforcement folks. It's private, it's confidential. We work off of a grant, and it is specifically for small businesses. So if we did share that information, other than when they're willing to, if we did share that information, that would look really bad for us, and nobody would invite us in. So please know that that's really important to us. So we're a very separate organization, distinct lines, and we communicate with our friends and colleagues in enforcement, but we may not communicate about businesses, workplaces that we go to. So how did I get involved? I had no idea what to do with Margaret's issue. So I happenstanced into the American Industrial Hygiene Association working group meeting. And they have a partnership, they're formalizing it with AIC, the American Institute of Conservation. Is that right? Okay. So we're formalizing that, but they've been working together for a long time. Well, they pounced on me. They said, where are you? You're in Alaska? And suddenly I became part of that working group, and now we're part of a federal working group. So OSHA has a very special smaller organization, or a smaller group, and there are 13 states signed on, and Alaska is one of them, which we're pretty excited about in our area. So, but why did we do that? Because we need some expertise when we go into your areas. I have to develop that expertise within myself and my colleagues, right? So that when we see a museum, we see your objects, you guys have an understanding that we don't have about approaches, about history of those objects, and what kinds of things work. But what we can bring to you is free sampling support. We can bring a separate set of eyes. If you guys come to my home, you can see areas where I don't dust, because we all get our narrow focus on what's important right at the time. And I know you guys are juggling a lot of glass balls right now. And so if we can come in and look at your safety and health issues, it just gives you another opportunity to address those. The other thing is, if you work on safety and health and you need someone to listen, and you have a formal report, then you can also use that for grant writing. You can use the findings in there. So we hope that we can support you in the same way. But originally this started because that same issue happened in Chicago over a decade ago. And in that, during that period of time, there were actually, and I know they were museum professionals. I don't know if they were collections care or laboratory staff. I don't know. But I do know that there were some toxic exposures in the workplace that a physician then referred them for some workplace safety and health review. And that's when OSHA recognized that this is an often overlooked industry. So, and these, you guys know, these are the areas that you have hazards. A lot of them can sometimes be very typical of any place else, like your facilities management. But your laboratories might look more like a lab where they have some toxic chemicals, right? You might have hoods. Your smaller museums may have objects that you're handling. And of course, there's safety, security, supportive research, archaeological digs. And sometimes I'm going out to facilities and finding that your facility staff are sometimes dealing with hypodermic needles. And so I like to be able to talk about that. There's a cleanup issue. Okay. So why do I say that sometimes you're often overlooked? If you look at this, this is called the total recordable case rate, and this is by industry. So your NAICS code is your North American industrial classification code, right? And so the Bureau of Labor and Statistics publishes statistics every year on injuries and illnesses. Well, if you look at your industry, it's here on total reportable cases, whereas here is your national private sector average. You're above your national private sector average. You're also above construction of buildings. Now, I won't take away from those, construction has an issue with fatalities, right? But I think I want to address this. You're even higher than healthcare and social assistance. Social assistance? Yes. So there's a need out there for us to be in your spaces. So what does an AKOSH visit look like? So it starts with a request form. Enforcement walks into your space, right? They walk into there, they have a complaint, they ask you for your records, and they're going to review your area. We're not allowed to do that. We have to ask for a request. You have to ask us in there, invite us in there. We can't ever just walk in. When you invite us in there, you can also keep it narrowly scoped, which that's been my lesson learned. I've been with AKOSH for 3 years. So we can scope this to what you want it to be. If you don't want our eyes to dart to anything else, we'll do that for you. So after an initial visit, you guys get 4 follow-up visits. So you say, Gina, I want you to come in and look at my hazard communication program, and I want you to look at my laboratory hoods. We can do that, and then we can follow up with sampling, and then we can follow up with training and education. So if you heard me just say that, that's 3 visits. So for my smaller remote areas, know that we can figure out how to give you 3 visits, okay? So then we do the coordination. We're gonna ask you what date works for you. Enforcement doesn't do that. They tell you when they're coming, but we are your partner. We're not gonna work against you. So whatever date works best for you, we'll try to accommodate that. We'll ask you the intent of the request, if you have any sampling needs, and this is the hard part. There's something called a safety and health management system. It's 58 questions that the Fed OSHA folks want us to answer. 58 questions. We have to answer 16. So we're going to ask you about your approach to safety and health management. It's important, right? How do you approach your overall management systems? So I have to assess 16 questions. I have a self-assessment that I can send you ahead of time. Almost nobody does that, and that's okay. But we'll set up, it'll take about an hour for us to ask some key questions. So the next time, this is during the visit. We'll also need to know if there's any particular personal protective equipment you need us to bring. We do, okay. And we'll do a walk around. We'll do sampling either during that period or during the follow-up, depending on what you wanted. And then we'll have a closing conference. So this is important. The correction date. Enforcement tells you when you have to correct something by. We work with you. So I know in the remote communities that I support, it takes a while to get things shipped over to their sites, right? So if I'm looking for an eye wash to be installed because they have corrosive chemicals, then I know that we've got to go 90 days. If you say, Gina, I can't do it for another 6 months, I will work with you on that, okay? So that's important. So the next thing, you're going to get a report. The report is a template. It's not personal. We address the hazards, and I'm going to even show you a sample hazard that happens almost all the time wherever I go. And then in there, we'll have recommendations, sampling results. There are a couple of appendices. There's the actual hazards. There's a list of hazards that has to be posted. There are Appendix B, that's the report you send to me, and you tell me that you corrected the hazard. You're going to make sure it doesn't happen again. And you tell me how, and then you sign it and you tell me the date that you corrected it. And please know that through the entire time that you're correcting your hazards, though, you're not alone. I will call you, I'll work with you, and I'll work on a sample. I'll give you a sample program, and I'll even help you develop it if you need. I can't do it for you because that means I'm authoring your programs, but I can help you through it. There's also an extension. If you said, Gina, I said I could do this in 3 months, but I can't, then we just submit an extension request, okay? There's a way around everything. But really, the most important part is that you guys have to submit a request, which I've got a request form up there. This is what a health hazard would look like. It looks very formal. This would be like, I could call it serious, other than serious, or regulatory. I'm gonna do what I can to call it other than serious if nobody's in danger. There are also some imminent danger hazards. I haven't seen those before. Those have to be corrected on the site. By having us in there, you're agreeing to correct all serious hazards and imminent danger hazards on site. So this is for a hazard communication program, right? Everybody, there's often a missing has come program. And this is a sample of what it would look like when you're reporting back to me on what you did. Published a final program, trained employees, and developed a plan to identify all safety and health hazards. It's pretty simple. So again, when you see that, it's not because I want to write all of this, it's because I have to write all of that, okay? It's just part of the administrative side. So building our knowledge base in Alaska, we can help with hazard recognition, collection sampling, exposure sampling. We're going to talk a little bit more about that. She's sort of bigger, Margaret. Identify regulatory requirements. We know that it's long. And we also know that some of the construction standards apply to you as well as the general industry standards. So we can help you with that, and we're glad to research it. And even if you don't have me in, please keep my card because you can call me for compliance assistance for free anytime. And I am glad to do research and learn. And then we have access to industrial hygiene experts, people with a lot of expertise through the working groups that we're on, both the OSHA one and the American Industrial Hygiene Association one. And remember, all information is confidential. So Margaret, this is you. You have access to a curations network.
Well, I don't remember what they are, so maybe you just. Oh, yeah. You know, when working with Gina, we just realized that the museum community has a bunch of knowledge that, like, we just don't speak the same language as OSHA. And so we have our own set of policies and procedures and language, and so that's been really cool to talk to you about. So, and then we also have our own contaminated object management approaches. So, like, for example, we have our object handling guidelines, and like, as we've kind of talked about in previous sessions, those can vary really greatly. Those aren't like this super standard federal OSHA policies. So, yeah, it's been really cool talking with her. Did I miss anything?
Yeah, I think that's okay. And when I need information on contaminated objects, I've called Margaret before to go, okay, what do you guys do with this type of a hazard? Do you know any curator level expertise, things that I wouldn't think of, which I've really appreciated.
And a lot of our knowledge, like, at least for me, when I come across something contaminated, I'll call it conservator. So like, usually we're just like, oh, we call it conservator, but I feel like the difference between calling a conservator in some of these situations and then calling Gina is OSHA can help. One, you do a lot of work for us. So for example, when we did our consultation with Gina, she worked her butt off to make sure we had all the template documents to be able to sustainably address whatever exposure or hazard we were using. So like, a hazard communications plan sounds like, oh shoot, I have to develop this. And it's like, oh no, that can be a one-page document in your emergency procedures. It's literally just spelling out how you communicate about that hazard. And so it was nice where she can just, it's not just she's providing you the test results, she's analyzing those for you. She's telling you, oh, hey, where can you improve that to be able to tell your staff, how are you going to sustainably make sure that this isn't an issue? In addition to kind of the stuff that we.
Okay.
Oh, I'm gonna keep talking. So just in the interest of time, so we met Gina in 2022 through Amanda when we were going through the PACO program, and so the Preparing Alaska's Cultural Organizations for Emergencies program, and we were all writing our emergency procedures. And so Amanda had the forethought to get an OSHA consultation at the same time, and so we did as well. which helped inform our emergency procedures. And that's where kind of those documents that Gina, like, you know, we didn't have a bloodborne pathogen plan, and that sounds really scary, but it's like, oh, it's a one-page thing that just tells you what to do. And so that was cool. So that's how we met. And then we had a follow-up visit with Gina because we just started, you know, chatting about some of the museum objects we have that totally have arsenic, like craft bear. And a lot of museums have taxidermy with arsenic or other things that are contaminated with like mercury or like mine tailings or something like that. And so she was like, oh, I can test that for free for you. And that was just cool because we think that the more small museums that, you know, have the ability for someone else to do the legwork to interpret those findings. Like I could go borrow an XRF machine, you know, in the next month and do the testing myself if I wanted, but I would have no clue what to do with those findings. And so that was helpful. And I'm just going to save everything else I was going to say for the panel.
Okay. So what we just talked about was sampling to catalog, and I think everybody here is familiar with what you do for that, right? And so you're going to get information on what the potential exposure is, what the sources of contamination might be that will be hopefully logged in your records, but it might not provide quite enough information to give you an exposure determination for the people who are actually managing your objects, doing the collections care management side. Related to dermal exposure, there's currently no, I just need to say this, no OSHA surface contamination criteria and no quantifications for skin absorption, but you can find that S for the skin designation on the contaminants that you contend with. There are housekeeping standards that apply, and there are definitely contaminant specific standards like for arsenic or lead and many others. But there's a difference when you're sampling to assess exposures. And that's, again, free. You can use us. We can provide both our time and the analysis for free. That's done through Wisconsin's Occupational Health Lab, and that is a certified laboratory. You can use a private consultant, and Brandy's here and can talk a little bit more. There is a fee associated with that. And then she also is working with a group that's putting together something called a museum's poisons test kit. And that's something that you can do remotely eventually. So, but I'll let Brandy talk about that later in a little bit. But really what you're responsible for as an employer is to look at your jobs, your tasks, and your people to make sure that you're protecting. You've selected the right engineering controls, administrative controls, you've substituted where you can, and that you're providing personal protective equipment that's appropriate. So there are standards and best practices, and you can find those in, you know, OSHA, NIOSH, the ACGIH, and state-specific standards. So Brandy, can you try talking just in case we can hear you?
I'm here. Can you hear me?
Can you guys hear her? Yes.
Okay. Just real quickly about the museum poison test kit, all I was going to say is the description of the process that we use to collect the samples for museum dust for the presence of heavy metals is in that link. So you can read about how we went about that. We collected side by side, basically surface wipe samples with an IH and a museum professional to see if someone with limited training could successfully find similar results to the trained industrial hygienist. And we had promising results. I'd be happy to share more on that process if anybody is interested. Later, you can reach out to me afterwards. But there is no specific test kit available for purchase or anything at this point.
And I think Brandy and I are talking about how maybe I could go out to museums and kind of work with her on some of these ideas. So exposure assessments, again, is everybody familiar with the hierarchy of controls, whether it's NIOSH or OSHA? And that's whenever there's a hazard to people, the most important thing you can do is eliminate the hazard, take the worker away from the hazard, right? Then the second thing, that's not always feasible, right? The second thing you can do is maybe substitute a less hazardous chemical for a chemical that has hazards. Then the next thing is engineering controls. Okay. Engineering controls would be like your lab hood. Administrative controls might be like substituting workers, rotating them out, and then personal protective equipment, which we're all familiar with. But I wanted to show you under exposure assessments, this is straight from the OSHA website. I bolded sampling data. So it's really important that you're reviewing your workplaces and providing sampling data. So I want to talk about sample planning. Can everybody see the slides? So you're going to find information on the object. You guys have a lot of information at your disposal. Safety data sheets, well, maybe not for all objects, but for most objects that you've cataloged, right? You want to know who's exposed, frequency, routes of exposure potentially, and the type of sampling needed. We'll work with you on that. Remember that we want to try and go for an 8-hour shift, and there may be some short-term exposure limits that apply to your situation. So we may change out, we might have two sampling pumps going, one for 8 hours and the other one maybe for the short term. But this is a quick case study. This is in, was it Sioux City, maybe? And AKOSH is here, but this is what happened. They went out and they sampled taxidermy objects. So initially there wasn't a support to assess and interpret the results, and particularly the potential exposure information. There was a bit of a community uproar because they were going to close the entire museum, 150 taxidermy objects. So some people wanted to close it. And other people said, we've been exposed to this forever. Why should we close it? So that's why there was a community uproar. But also, it was prime real estate. And another museum organization or section wanted that prime real estate. So they wanted the taxidermy items out so they could move into it. And so AIHA, AIC working group member provided advice, and the museum is still currently closed to the public, but it's pending master planning. And here's what our panel member, Kodiak, provided when they were writing a little bit. There were a lot of news articles. And I'm just going to read this slide because it's important. To accurately determine that risk requires an in-depth exposure assessment. It includes monitoring the breathing of a visitor as they go about their business. So that's for visitors. I'm concerned about workers. And taking wipe samples of anything touched to test for cross-contamination. Museums can then make adjustments where needed, such as enclosing the mounts in airtight glass cases or working with taxidermists to redo the mounts when with arsenical pesticides. So I thought that was super important. So now that leads us into our panel discussion. I have great slides, but the only way you can see our panel members is if I switch. So I'm going to go ahead and switch. And we'll stop share. Can you guys see that? No. So now we're going to share. Randy, are you on?
I'm here. Yep.
Okay. So we're just going to try and work on how to share now. I'm going to let you control. Let the young people do this.
Something weird happened. Here, we gotta go like that.
You can actually even just close out the presentation if that would make it easier.
That's what I was trying to do. Okay,
There
there they
we go.
are. Well, so now it should hook. Can you say something for test?
Hello. Testing.
Hello.
Well, the sound is now supposed to hook up to this, which it's not. Let me turn the sound all the way up. Can you say something again?
Hello.
Hello.
All right, everyone. So they were supposed to move out of this speaker. Can I ask both you two to like very much project because our speaker isn't working? Thank you.
Okay. Sounds like a plan.
Okay. Can you hear it all? Okay.
It might be on automatic.
Oh. Do you know how to do that really quick? Oh.
Also, we can't really hear you, only the person sitting in front of the screen we can hear.
Okay, so we'll have to reiterate questions in the Q&A. Okay, we could do that. Well, we'll just do our best.
Also, I assume there's people in the room. It looks like we're talking. No.
Turn around.
We'll turn you around for just a hot second.
Oh, there's everyone.
Probably keep from like
Oh,
this and then
yeah,
the
that's a
speaker
great
will-
idea.
Can you see everybody?
Hi.
So we already introduced Stephanie and Amanda, but on the screen we have Randy Howard. So I'll ask them, she is a group manager of industrial hygiene and asbestos at Curator Denver office. You already said, Eric, great.
That's who the quote was from. So, and the poison testing. I saw winter their bag today, Karen, and I got very excited.
Okay, so we just have.
I think you're gonna have to stand by them. Sit by them.
Can you hear us?
We can hear you now, but I couldn't hear what people were saying before.
Okay. Margaret's coming.
That's okay. Can you hear me now?
Yes.
Okay, so we have 4 questions for everybody, and if you guys have questions, which you probably do, just save them for the end because we'll have ample time for Q&A. Okay, and so we're just going to, whoever wants to talk first, go for it. And I'll moderate if we need to. We'll have about 7 minutes per question if we need it. So our first question is, why would you ask for objects to be sampled in the first place? And why would you ask for workers to be sampled? Does anyone want to go first? I guess I can actually go first because I was the one that asked for workers and objects to be sampled. Well, I mentioned it before, we're a really small organization. And so when we were already working with somebody who was trying to help us with all these other documents, they're like, oh, well, it's free and someone's actively helping us and we developed a good partnership. But also we kind of had some alarm on our staff or like with visitorship or as researchers, if we were to say like, oh, hey, like use gloves, use precautions when handling this. And it was like this kind of huge ordeal. And people became alarmed because they're like, there's arsenic, like, am I being exposed? And so I just really wanted data for ourselves to just, I'm assuming that when we get the dermal and respiratory testing, that it probably will show that you're not actually very exposed, hopefully. But I really wanted that data to show that and be able to share that with other museums, to just call us up and be like, this is what ours is. We all have taxidermy in our collection. So that's why I asked.
Yeah, I think for us, if there was a compelling reason to suspect a contaminant, or if the object was going to be displayed, transferred somewhere else, or worked on by a researcher. My predecessor proactively bagged some taxidermy birds, probably in response to the monitors flying to the State Museum. And so if we were going to display those, or if someone was going to do research or we were to transfer them, I think that would be a good opportunity to have this. You know. Somebody just said something, maybe the pesticides, and notice that the collections are in really pristine condition and nothing's been chewed on. Unfortunately, the research but you know, if somebody read a come across like some sort of report or something doused in a liquid completely, normally it's a good flag and time to go and start being trained.
That was Stephanie. Kareth or Brandy, do you guys want to chat?
I couldn't really hear what the last 2 people
I know,
said.
I'm gonna ask you guys to move up here with us if you don't mind.
Here, I'll move there.
Oh, no, no, no.
Oh, no,
Please don't
stay,
stay here.
stay.
We've got chairs.
It's okay. I don't think you'll reiterate. Why would you ask for objects to be sampled, and why would you ask for workers to be sampled from your perspective?
So as a consultant, I typically get involved after somebody else has already raised a concern or a question, right? And it's usually about exposure. So in that case, I would typically recommend sampling the worker so that we can see what those actual exposures are. I have also sometimes been involved in testing surfaces for contamination. I don't typically test objects directly due to the handling and stuff. I tend to rely on a conservator to help me with that. So I don't know what you want to add, Gareth.
Maybe Stephanie already said this, but for conservators, we're working with these objects quite closely and intimately, and we often have an exposure that would be different than someone who's just coming into a work area or a visitor that's coming in, because we're actually vacuuming these things and cleaning them and handling them quite closely. As a manager, there are often times when you can say, we know that this collection has been treated with arsenic. Let's just assume everything is treated with arsenic, and we'll do all the proper PPE and handling techniques, which can be pretty expensive if you have to throw things away as hazardous waste and do all of that. So sampling and testing and finding out that perhaps you don't need to take all those precautions can be a cost saving for you in the long run.
And we found that too. We actually had Gina test 2 bear taxidermy. One of them was a rug, and it turned out it didn't have any heavy metals in it, which was great. It's not like we would do anything a whole lot different, but if we were to clean it or move it, we don't have to deal with that. Okay, I'm going to move on to our next question. What are any limitations to getting objects sampled?
I'll start with with the new NAGRA protocols that have been recently updated, that they're returning more agency to the tribes to determine things, which means people need to be reaching out and consulting and to actually get approval. And part of that with those categories that fall under it, which are human remains or associated or unassociated burial items, sacred items, and items of patrimony. Pesticide testing, hazard testing would be considered a form of research. And so it is something that you do have to consult with the different groups beforehand and taking any sort of samples on those categories.
I think I would just say, as a consultant, I'm relying on that. This is where curator and collections management knowledge comes into play, is to make me culturally sensitive, right? I'm very left-brained. I just want to focus on the sampling, but I need you guys to keep me honest and make sure that I'm doing the right thing when I'm there. So I'm going to ask you to be right by me while I'm doing work to come to the facility.
I think beyond sort of like the spiritual care aspect of testing things or not testing things, we hold a lot of objects for tribes. And so, understanding that not all things are within our purview to test, like we need to seek permission because these objects belong to someone else. So that would be one limitation for us.
Is it in any of your agreements with land management agencies or tribes up front if you can test?
Mm-hmm. So in our loan agreements, we have options people can sign off on, and that is one of them. So much research in that case.
It's fine. We're on time. Mm-hmm. Do you two have anything to add? This one wasn't really your question, but
Well, Kara.
oh yeah, Kara.
Yeah, I think Brandon and I would both mention that there's a cost associated with these things. You all have Gina available to you, but not everyone does. You may not have the equipment. Not everyone has an XRF in their collection, and the objects may just be of a material or a condition where they can't be sampled. Sometimes these surface wipes are often wet samples. So if you have an object that can't get wet, you can't do that kind of sampling, or things just may be too fragile to sample.
And then also sometimes it can be difficult to interpret the results once you do get them. Was it a cross-contamination issue? Did it come from the object? Or is it a health hazard or not? So, you know, there's a lot to it.
You're right, Brandy. I'm glad you said that. So because it's free to us here in Alaska when you haven't come in, I did what's called a full metal scan, and that was really dumb. So I've had some lessons learned, because then what do I do with all of those metals to interpret them for you? So we're going to target what we know are our contaminants of concern.
All right, I'm gonna move on. How do you mitigate risk at your institution, Brittany?
I'll do that one. I'll take on that one first. So we have signage or some kind of language in lots of different ways about how things might be dangerous. So like the birds I referenced earlier, there's a sticker on them like a skull and crossbones, very clear. It's also in the accession register that those items could be contaminated. It's also in like the hard copy accession record. So any way you approach the item, you'll know immediately that it could be risky.
Brandy, can you test that real quickly, and then we'll get to your question. Can you test the, just kind of speak real quickly?
Can you hear me?
Yep, but not on the,
Usually on Zoom, you can choose when you enter.
Okay, try it now.
Testing.
Oh, so yeah, like what Monica was saying earlier. So.
No, but this is.
Here we go. There, yeah, right here. There we go.
How about now? Is that better?
Now try.
I'm here.
Thank you.
Oh.
Okay, we're really prepared. Thank you, JJ.
The microphone's still there.
yeah.
Okay, yeah, you still have to stay here.
Yeah.
It's fine. And just to reiterate what I was saying earlier, like I realized like to mitigate risk is putting it in, we're a small institution, so it was very easy, but like working with your other departments, so maybe your operations, to make sure collections protocols are actually in your other documents. So for us, it was like our PPE plan at the time didn't mention anything about collections. We were just like, oh yeah, that's in the collections department. It's in our object handling guidelines. And so like, just wasn't in there. And so now that's another way we mitigate risk, is just telling everybody, making sure it's in all of our policies, even if it's not just curatorial or collections.
Well, like you and I, we write our emergency plans and we are collections, but like that's not the case everywhere. Like sometimes operations managers, right? You know, and they may not have collections experience.
Mm-hmm.
I think, yeah, when it comes to communicating, doing it as plainly as possible and as clearly as possible. And some of the places we've worked, when we know that there is contamination, it gets labeled and it's coordinated between like the collections department and conservation. And then the stuff is also communicated to exhibits and other parts of the museum, so that they can have proper health and safety stuff put in place for them when they're working and making counts. And then on top of that, put in barrier layers when something goes in display so that there isn't cross-contamination further. And then, okay, we know that this thing has heavy metals, so let's store it on the bottom shelf so that you don't have heavy metals falling down on other collections items. You normally would put some sort of barrier around it, some sort of plastic and some sort of housing. But it is very important to communicate and to communicate clearly with everyone who will be working.
Good point. Kara, do you want to go next?
I couldn't really hear the last one, but training of anyone who's going to come in contact with this is really important. And it's important to think about not just whoever's in your department in particular, but are your art handlers or your registrars. Is it going out on loan? You should send, it out to your borrowers that these things could be hazardous as well. You know, larger institutions can often put things in sealed cases, particularly things that are considered extremely hazardous, like asbestos, if you have asbestos contamination. But those things are often not available to a lot of people. And so if we think about the hierarchy of controls, elimination does not necessarily mean it has to leave your collection. It may be that maybe that's something that doesn't go on exhibition. Or the next one is substitution. Can you substitute out a similar object that doesn't have the same contamination on it?
Last question. Is there an opportunity to build collective knowledge in Alaska, or more collective knowledge in Alaska? I think we should start with Kiris and Brandy on this one.
Is this I can't see the screen. Is this the barrier to contributing one?
Yes, we had in our practice. Yeah, it's kind of like, is there a barrier to
Okay.
collective knowledge? Yeah.
Yeah, I think one of the primary ones is sort of the embarrassment people feel, particularly as it relates to arsenic contaminated artifacts, where the museum itself is responsible for making those objects contaminated. And I think, as a community, we can sort of try to overcome this shame and sort of understanding that we can have sort of a communal good that comes out of it if we share this information. It can be difficult to do any sort of epidemiological study if people aren't willing to participate. So we're a very small group of practitioners. And so if we want to know if our exposures are actually having health effects, we need people to participate in these kinds of epidemiological studies, which is what the American Industrial Hygiene Association working group is trying to establish. Because again, part of this process is identifying your hazard, determining your exposure, but then also understanding if you're actually seeing health effects from that exposure. So it's a long, kind of expensive and complicated process. So that's definitely a barrier.
And then as far as opportunities go, we do have, as has been mentioned several times, this AIHA, AIC Museums and Cultural Heritage Industries Working Group, which is a volunteer organization and has several different projects that we're working on. I know we'd be happy to contribute or participate, in any way that you guys would want or need. So.
Just to kind of continue on with what Eric was saying, there's a lot of anecdotal information out there. There isn't really a lot of hard data. It is quite hard to find. We're just a small community, and sometimes they just don't think that's a viable industry to look at. And a lot of times that industry is very much focused on construction related stuff that's been really vetted out pretty thoroughly, compared to like us, just a smaller group. And so that can kind of put up those barriers as well.
From just like a museum collections management standpoint, there's so much else to do in our jobs, like that we happen to be working on the PACO and the emergency response plan, and so that's why I reached out to Gina. But just we all have so much on our plate that this can seem like just like a nice thing we'd like to do if we have time. And
we've got stuff like competing demands, and then there's just other bigger priorities. And if you have like financial limitations, you have to kind of figure out where which priority you want to go for. And this is like probably the biggest part of it.
All right, that's the end of our panel questions. Do you want to pull up the rest of the slides, or now that we have them on the speaker, maybe do you want to just read them off my computer and we could put our contact information up at the end? We could do Q&A now.
Sure. Are you guys okay with Q&A? We'll repeat any questions that you can't hear.
Sure.
Okay, we'll do that.
Questions? Yeah.
Taxidermy keeps coming up as the example. Can you give some other examples of common objects that tend to be suspicious or where you should have concern?
Mostly
red
mostly
flags?
organic materials, stuff that would be a food source for pests. Wool, it's kind of a big one, basketry gut needs to come through as well, that'll end up, may have been due to pesticides to prevent folks from eating it.
Simply contaminant is the pesticide that's used to preserve those things or something else?
Something applied to prevent pests from eating it. And then there are times where there are things that have inherent hazards, and then that is something I think Kara could probably speak more to.
I'm glad you brought that up. Catherine Marcos always talks about inherent hazards versus acquired hazards. And so the pesticides would be those acquired hazards. And then, of course, inherent is material.
But I think, like I know for the Haynes Sheldon Museum, like Scott Garley came out and did all the testing when CJ was there, and hopefully you'll have records. So one of the first places to start the records at your institution is he did do a big push across the state when he got the XRF grant that then went out and around, and a lot of small museums got tested by him specifically. And then those of us who were trained at the same time, did our own institutions. So that, I mean, there's a long history just in the last 20 years here in Alaska of that work being done. And so, always making sure to go back into your own records, looking at that institutional knowledge.
So, and the XRF sampled for heavy metals, right? But there's also the organic pesticides.
Right, which we looked at, like
We've done
borings
like
and
sampling.
no, he would have done it because
Okay.
we wrote the book with Nancy Odegaard on materials spot testing. But I don't know what, I mean, I can't speak to what he did outside of the XRF because he was the curator of these conservancies. Went around.
What's his name again, so I can repeat?
Scott Carley.
Scott Carley, you guys. I don't know if you know that name.
You would only know it, well, he
If
was
we
at the
read
National
the
Museum
Nancy-
of American Indian during the MOVE project.
Okay.
And then he was up here from 2000 to 2000.
Yeah, this is kind of along the same lines, but in one of the parks I work at, in the visitor center, there's a bald eagle hanging from the ceiling. Is that a problem for visitor safety? I mean, nobody's disturbing it. They can't touch it. It's, way up high, but yes.
So it may be, but also consider that visitors are there for a short period of time.
Mhm.
So yes, it can be a hazard. You should sample in order to understand
Right.
that, right? But visitors are there for a short period of time and they're probably leaving. They're probably not coming repeatedly, right?
No, yeah.
So that's where we talk about exposure assessment. There may be a presence, but maybe you want to have your workers sampled. to
Yeah.
Figure that out.
Okay, yeah. I don't think it's ever been cleaned, and on our collections management plan, it recommends that we have it cleaned and tested, so.
My
You-
phone is right over there. Can you come?
Okay, yeah, I want a trip to Glacier Bay? Yeah.
Visits.
I think there's a few other things that need, I can't remember exactly what they are offhand, but it's in this plan. And they did,
And you know what, I say the 3 visits and I'm asking you to have you come out, just so you know, we're working off of a federal grant ourselves. And you guys all know, if you're dealing with grants, it's based on numbers. So if we don't have enough numbers of visits, if we don't have people asking us to come in, because again, we can't just walk in, then we could be in jeopardy of losing that ability. Yes.
So speaking to that, so I come from, and I'm just a guest, I come from an academic auditory background, and it was a challenge because I know you're AKOSH, and there's the federal OSHA level, right? And the laboratory standard isn't enforceable. It's just this like really good idea, right? But general industry is enforceable. And then you have museums that are these educational spaces that are like this gray area, this blend. So if you have to be invited to come out, how are you making sure that, like, I know this conference is a good place. Hopefully you guys are going to disseminate like good information to all the other small museums, right? Like, because a lot of people just don't know, especially if they invite you in and you're like, hey, I saw all this crap you need to deal with. Even if it was general industry OSHA stuff, you can't be fined for not taking care of it immediately because they invited you in to come help them fix it, right?
Yes, so you're talking about that limited protection when we
Yeah.
come into your facility, yeah. So while you're working with us, you have protection from what's called they kind of walk in and they decide enforcement. When I
They
say
go like,
they,
where are your safety data sheets? And whoever goes, I don't know, they're like, interesting, fine. Like, yeah.
The other thing, since you're from a laboratory, I want to speak to this particularly. The Environmental Protection Agency, are you familiar with TSCA, the Toxic Substances Control Act? So they've got this new rule on methylene chloride. And so I've been trying to start reaching out to laboratories because one of the issues is you have to sample to make sure that you're down to their exposure limits. It's a new exposure limit, and we've not seen EPA do this. We've not seen them include workers. Usually that's our job, that's OSHA's job, right? But now the EPA has promulgated and the president has signed into effect these methylene chloride standards. So you have a period of time to use it, but you have to sample for it by May 5th. Their standards are much lower than OSHA standards because OSHA standards is just the basics that you have to do to protect workers. It's not very high up there, right? We don't have best practices. We have the basics that industry allowed us. We're talking about a TW8. So TWA 8, that's an 8-hour exposure of 25 parts per million for OSHA versus 2 parts per million for the Environmental Protection Agency's ECEL. So if you're in a laboratory, please submit a request form and let us come out and help you with that exposure.
So it's weird because I was with academic laboratories at university. So if you don't have a lot of work going on, you should probably reach out to public school science laboratories. Your eyes will just like Tom Jerry. Yeah.
So I can only go to small businesses.
Oh, see, then there's that gap.
However, our director has started allowing us to go to state agencies. So if
Good.
you're a UAF,
Yeah.
you're a state agency there, right?
Awesome.
So those are exceptions. But we want to get into small businesses. That's what our grant is for.
Okay.
It's to help
what
smaller
about it?
organizations.
Federal agency.
Yep.
No, okay, so I work for the National Park Service.
I can tell you how to get some help.
Okay,
There's something called a health response team. You can request support from the OSHA health response team. If you need that, you send it up through the OSHA feds. They can come out with an XRF. They can support. It's all competing against other priorities. Right now, I'm sure we're going to see some disaster responses down in Florida. Write down HRT, OSHA HRT, and if you need more information, my contact information is on the speaker.
oh, okay, okay,
And my card's over there.
okay, great.
Yeah.
This is kind of about the visits. So are you using the grant money that you're getting to conduct these visits, or is the institution?
This is free, totally free to you. This is
Okay.
our money, our travel, our sampling, our analysis. We send it, like I said, to Wisconsin, totally free. It's just, do you want us to come in? We're gonna have to write up hazards. We're gonna
Right.
work with you as much as we can.
Okay.
But yes, it's free. It's crazy, right?
I
I didn't even know it existed.
I asked specifically because, I'm in the Aleutiiq Islands, and it's very expensive to get there. So whenever we have to act out, it's always a big deal to try and get the funds to get people.
revisit, get me an initial visit,
Yeah.
let me train you guys on hazard communication, and let me do a sampling visit. We'll get 3 visits. Okay?
Yeah, we didn't pay a dime.
Yeah,
Didn't pay a dime.
and Gina just followed up with so many templates and just is really good about answering the phone, and it was easy. But feel free to call Amanda and me if, like, you or your leadership has any questions, because it can be scary, like, but it's not.
But it really is confidential. Like, I've been telling Gina for like a week, you can tell people I invited you. And she was like, I can't.
Can't.
I'm telling you, it's on the record.
Well, and can I, if you're in a tribal organization and you want us to talk to your board before inviting you out there, I am willing to do that. I can do it by Zoom. Please just let us know. We understand how tough this is to have government people come in. So just let us know.
And you had mentioned, so you're really focused on small businesses. Can you elaborate a little bit more? So my museum is owned by the city. Would that be within your kind of spectrum, or?
So 250 or fewer employees, or 500 nationwide is how we define small businesses. However, so we also, you know how you have gates in your grants, right? We have to have a certain number of public visits. So if I can call you a public visit, then yes. And I don't know which city and how many employees there are, but.
I'm under that number. So,
Okay,
yeah.
yeah, absolutely.
Okay, thank you.
So the whole process seems, you said scary. And so my question is, so you get to report, and you get the report, is there a point where you get nervous about the public then saying, we want to see a report, and now we've been exposed?
The public doesn't know.
Exactly.
It's strictly
So
confidential.
You get all that confidential, but if you start talking about the visit and government coming in, now the public finds out, it's that scary little gray area, and I just want to know how you have handled that.
I mean, I think I would frame it as, we are trying to do the best for our community. Like, we could just pretend that we don't know or think so, but taking proactive steps to protect people, I think, is the way I would frame it.
That's the way we have framed it. Yeah, it's just, oh, now, yeah, we're OSHA compliant. That's cool.
Margaret, wasn't I there during a cruise ship?
She was literally there during her cruise ship day. I mean, you did not identify yourself. You looked like anyone else.
But I mean, in the interest of transparency, and that's what we're all after, I think being transparent, saying, we were worried. We're collections managers, we're warriors, so we want to look out for it.
Is there that potential that now you have it and the public go, we've been there a million times?
You mean like the testing the item, like the
Like the items, so we've been exposed and we've been there, do they have a way to come back?
And that comes down to that exposure assessment versus presence.
Yeah.
Remember, visitors are there for a short period of time, workers are there every day, hopefully.
yeah.
Right.
And that's why Gina's gonna come back for her 3rd visit to us and do the exposure sampling.
Right.
And then we'll just have that data of hopefully we're not exposed, but it's an easy fix if you are. And like we've even had like a huge reason why I wanted to get it sampled is just kind of, we do have a lot of turnover in some of our, front of house positions, or we have had previous leadership or members of the community being like alarmed when we're like, oh, wait, don't touch that with arsenic, and like kind of starting to spiral. Right. And you're just like, oh, but actually having that data is just like, oh, just it's in the object record. We're good. Just don't lick it, kind of thing.
Yeah.
I just wanted to also mention, since you are looking at having employees monitor for any potential exposure, that also comes with like a paper, like records retention rules. Like you're gonna have a plan to go off to
30 years. Yep.
30 years from point of exposure, so make sure you're.
But that's
good
true,
to know.
your safety data sheets too,
And
right?
30 years from the last time you had it in your museum. When I started at my university, they're like, don't worry, we cleaned out the safety data sheets for you. Like, awesome. I fixed it. But
We've got transparency and clear communication, and not using emotive or like scary language. You just very clearly communicate the information.
And if you're not comfortable with us, I see your hand, I'll get right to it. I want to make sure you know that when you deal with a private consultant, and Brandy, feel free to chime in, that they are also under ethics rules, right? That your report, you work that with them as well. So this obligation between a consultant and a recipient is very serious. Brandy, do you want to talk about that at your organization?
I couldn't quite hear all of the conversation or the question, but yes, so I'm a certified industrial hygienist, and I'm also a certified safety professional. As part of holding those credentials, we are held to certain ethical guidelines. In addition, just our contractual guidelines from when we're working with a person. But basically, when you hire us, you own all the data. We're going to advise you. We're going to give you all the advice that we think you should have. But what you do with that information is yours.
And I saw your hand.
Yeah, so we've been talking about a lot about kind of the scope of this, but I'm curious about like overall environmental hazards in the museum, and if there's things like structural issues, problems with the roof, problems with like the building, where does that come into play in this kind of conversation, and what are the potential risks to an institution?
Where did you say you were?
I'm at the track museum.
And it's kind of wet there.
It's very wet there,
Yeah.
and we've been trying for a very long time to get a new roof, and we're working on it, but the city is dragging their feet on giving us money. We have federal interest in helping us, we have foundational interest in helping us, but the city is giving us problems, and I'm new to the state. I'd really like to get involved in, this kind of exposure training and getting us a handle on our collections, especially because they've been out for such a long time. But I also, it is a little scary to think like, oh, what's going to happen? Is the museum going to have to close if you come in and are like, the roof is a problem? We know it's a problem. We're trying. What's the situation?
Is it because it's like an imminent danger hazard where the roof is going to fall on your museum and workers are going to be exposed to?
I don't think we're at that point. I mean, we're at the but it's that's I guess what I'm asking is like,
Are you concerned about indoor air quality?
Not yet. Not yet.
Something that was really surprising, because I had the same thing, because we're in the oldest occupied, building in Alaska, and a log structure. So I was kind of freaking out. But what was surprising to me is when Gina sent us back her report. It's a long report. There's quite a few things. But that's where the serious, what is it? It's like
serious regulatory other than serious, yeah.
And the vast majority of her stuff was other than serious. It's a hazard that she's pointing out. So she that's why she was asking you those questions. So it's like likely the roof will probably be something other than serious. So you'll have all this documentation from OSHA about why that you can use, but unless it's a serious imminent hazard that's going to hurt someone, you don't have to change it.
Well, we'll know.
I mean,
we'll tell you
yeah,
but the roof wouldn't be a safety, if the roof isn't a safety hazard, if it's an environmental hazard, that's not on our report.
Okay.
So it's the occupational, so the worker safety and health issues. That's our focus.
Okay.
The only reason I bring up EPA is because we can help you sample.
Okay. That's okay. There we go. That's kind of where I was like,
Unless there was like mold growth.
I don't think we
from all the leaks.
And that's, yeah, that's the indoor air quality issue. It's homework.
it is homework.
It's
I just got here.
Then that might help you get a new roof. If you have that.
So I didn't get to tell you that Brandy has worked in Alaska because we've been trying to rush through. So she also understands these issues. Kareth, we're going to try and bring to Alaska next year at the next Museums Alaska conference. Right?
I'd love to come to Alaska.
It'll be in 2 years' time.
And 2 years.
Yeah, it's every 2 years.
Okay. And Brandy, hopefully she wants to see her old stomping ground. So.
That would be great.
Any other questions?
Thanks for listening.
Yeah, thank you very much for having us.
Thank you so much. It was very interesting.
Okay, say goodbye to Brandy and Kara.
Yes, and
Thank you.